We told him not to.
Hey, hold on.
He's not working on a furlough day.
Hey, Bill, it's like I told Bob Jarman once, there's certain things in this business where you just can't not see.
Mr. Stevens, we're recording. We're recording.
Okay, we're recording.
Good morning and welcome to San Juan County Council's Tuesday, July 21st, 2020 meeting. We now call the meeting to order at 9:01. If we could all rise for the flag salute. Ingrid?
I pledge allegiance to the
flag
flag
of the United States of America, to the republic
which it
for which it
stands,
stands, one nation,
under
under
God,
God,
indivisible.
indivisible, with liberty and justice for all and all.
Good morning. Welcome to San Juan County Council's Tuesday, July 21st meeting. We now will do a Coast Salish acknowledgement. Let us all acknowledge we reside on the ancestral lands and waters of the Coast Salish people who have taken care of these islands since time immemorial. We have no excused absences. Has everyone had a chance to look at the agenda today?
Yes, sir.
Mm-hmm.
Do you have any questions or changes with the agenda?
Nope.
Mike, is there any additions, or do we need to have a closed session or executive session? We have a closed session, executive session.
Just a closed session, I believe Mr. Wolf wanted.
Great, thank you very much. All right, nothing with the agenda. Have you all had an opportunity to read the minutes today?
Yep.
I would entertain a motion for approval of the minutes.
Mr. Chair, I move we approve the minutes for the San Juan County Council meeting of July 13th, 2020.
Second.
We have a motion and a second for approval of the July 13th, 2020 minutes. Is there any questions or comments? Without seeing all those in favor say aye.
Aye.
Opposed? Motion carries 3-0. Thank you.
Mr. Chair, I move we approve the meeting minutes for the San Juan County Council meeting of July 14th, 2020.
Second.
You have a motion and a second for approval of the minutes for July 14th, 2020. Is there any comments or questions?
Nope.
Without seeing all those in favor say aye.
Aye.
Opposed? Motion carries 3-0. Thank you.
Mr. Chair, I move we approve the meeting minutes of the San Juan County Council meeting of July 15th, 2020.
Second.
We have a motion and a second for approval of the minutes for July 15th, 2020. Any questions or comments? Without seeing any, all those in favor say aye.
Aye.
Opposed? Motion carries 3-0. Thank you very much. Have you had an opportunity to look at the consent agenda, and do you have any questions?
No questions.
No questions.
Without seeing any, please, I would entertain a motion.
Mr. Chair, I move we approve the consent agenda for the San Juan County Council meeting of July 21st, 2020.
Second.
We have a motion and a second for approval of the consent agenda for July 21st, 2020. Any questions or comments? Again, without seeing.
No comments on consent.
Without seeing any, all those in favor say aye.
Aye.
Opposed? Motion carries 3-0. Thank you very much. Is there any correspondence? I don't have any listed here today. Is there anything from either one of you?
Nope.
All right. At this point, do we have any public access? So I have a few letters that I will summarize. Let's see. All right, so I am going to start and go down the list. Alan Smith, do you have any public comment right now?
No public comment, just here for the radio discussion.
Great, thank you, Alan. Dale Heisinger, do you have any comments?
Not at the present time. Thank you.
Great, thank you. Perrette, do you have any comments for council?
Not at this time, thank you. Just listening.
Great, thank you very much. Mr. Felt, do you have any questions or comments at this point?
Thank you.
Great, thank you. Mr. Tony Gazelle, do you have any comments or questions?
Not at this time, thank you.
Great, thank you very much. I have someone at a phone number 360-378-7689. Do you have any comments? Okay. At this point, is there anyone who has called in who would like to provide public comment to this council meeting today on July 21st? One more time, is there anyone who would like to provide public comment via the call-in today for July 21st? All right, without seeing any, I have a few letters that I will summarize as we normally do. First one is dated Tuesday, July 21st from Charles Richardson. While I appreciate the work of Dr. James and the Board of Health, the community is not getting enough information about the positive cases. There are some privacy concerns, but those concerns should not prevent answering the following questions. 1, of the positive cases which are due to residents leaving the island and coming back. 2, have any tourists been tested and found to be positive? 3, of the positive cases involving residents, in what setting did they encounter the virus? Restaurants, churches, homes? 4, has there been community spread on the island? If so, in what setting did this occur? 5, of the positive cases on the island, were any of those cases in customer-facing roles? 6, were any of the positive cases working in restaurants? The restaurants don't need to be named, but we need to know why Dr. James was uncomfortable with indoor dining. These are the kind of questions both the community and the council need to have answered to make informed decisions. Charles Richardson, Friday Harbor, San Juan Island. Terry Foster from today. As a county resident in Friday Harbor, my voice is stay where we are until the tourists are finished infecting the county, then proceed to phase 3 maybe in October somewhere. I wouldn't dare eat at any restaurant until summer is over. Terry Forsyth, excuse me. Michael Reardon from Monday, July 20th. Let me read into the record a paragraph for the summary of the Washington Department of Health Situation Report number 9, published on Friday, July 17th, in parentheses. Washington State is in the early stages of an exponential statewide outbreak that has zero chance of being reversed. Without changes to our collective behavior and policies to support the change, if current trends continue, we expect the schools will not be able to open safely in the fall. Further transmission control will require enhanced compliance with masking and distancing policies and further restricting gatherings that likely fuel virus spread. This is a matter of utmost urgency as we have seen from the beginning of the pandemic that measures enacted sooner have vastly greater efficiencies. The end of the quote. Back to the comment. Under these circumstances, any vote not to withdraw the county's application to move to phase 3 of Governor Inslee's Safe Start program can only be viewed as irresponsible. In addition, the county may need to contemplate further measures in order of severity. Number 1, closing all restaurants to indoor dining, allowing only outdoor dining and takeout. Number 2, closing all transient rental facilities for a month or more. Number 3, prohibiting all travel for non-essential purposes. I had hoped that reopening restaurants and transient rental facilities 50% of capacity could occur this summer, but I no longer feel that way. It looks like external events in Washington State will not permit this to happen without undue danger to San Juan County citizens, including the likelihood of initiating community spread of the coronavirus. As Situation Report number 9 states, this is a matter of utmost urgency. Please vote accordingly. Sincerely, Michael Reardon, Orcas Island. Richard Clark from Thursday, July 16th. The Facebook link below is disturbing, especially regarding the actions taken by one of you at yesterday's council meeting. I'm glad one of you is retiring. As for the 2 remaining, I hope you're trounced in your re-election effort. Carol Wolf and Sharon Cavisto are getting my vote in the upcoming primary. It's time for competent government in the San Juans. I'd also add that common perception of Dr. James versus you 3 is like Fauci and Trump. One is honest and acts with the best interest constituents in mind. The other pushes misguided agendas, and your collective case reopening the San Juan County tourism industry to the detriment of the health of San Juan County citizens, especially 1/3 over 65. How much blood do you guys want on your hands? I've taken time to do my utmost to undermine San Juan County's phase 3 application by messaging Inslee, Wiseman, Habib, Lovelet, Ramel, and Lekanoff. As for one of you who apparently supports Dr. James' phase 3 withdrawal decision, bravo. Don't reply. I'm not interested in hearing your BS, particularly with our esteemed District 2 council member. I've heard directly and read your self-serving shtick. I'm tired of it. Have a nice meal in a crowded Friday Harbor or East Sound restaurant. You've earned it.
Mr. Chair, I thought we were summarizing these. That's what we agreed to last week.
Okay, my apologies. The next one's from Kim Secunda from Orcas Island. No on phase 3, Titan not for sale, seriously. Kevin Carter has sent us a document regarding the San Juan County Resolution affirming commitment to a safe and inclusive organization. He sent it to all of us. There is a petition with, I think, 100 signatures, and this group of people have modified, and community members have modified the document that was in front of council a while back. Christopher Evans is the last and final one. It's very long. Basically, it's addressed to me. It was in the papers yesterday. Disappointed with my leadership and my ability to not support moving out of phase 3. And that is all the public comment at it is now at 9:11. We have a public hearing at 9:15. We will take a brief pause for the next 4 minutes, and I will be back at 9:15. Thank you. Sorry, does council have anything they'd like to discuss for the next 4 minutes? We'll take a break.
Yikes.
Hello and welcome back to San Juan County Council's Tuesday, July 21st, 2020 meeting. We took a 5-minute break so we could get into our public hearing at 9:15. It's now 9:15. I will open a public hearing, which is a continuation from July 14th and a continuation from the week prior. We have a public hearing to adopt an obligation bond ordinance with Rhonda Peterson, Treasurer, and Mike Thomas. Mr. Thomas?
Good morning, Mr. Hughes.
Morning, sir.
So this is yes, we've pushed these ordinance forward the last several weeks. This ordinance only makes sense in the context of the radio system project. I have blended items 1 and 2 together, and I have a PowerPoint presentation that I can talk about the bond and the other agreements that constitute the radio project. The draft bond ordinance that you have is unchanged from the one that you received several weeks ago.
So, Mr. Thomas, real quick, let me read the second action item that we're working together on this. So, the action item is to approve a resolution authorizing a statement of work with Codan Communications and service level agreement with Rock Island Communications. So, just for the public, the bond is an ability to pay for this 911 communication system that the voters approved for a sales tax increase to cover this in November. So, Mr. Thomas, please.
Yeah, so with respect to the bond, as I suggested to the council in the last several meetings, that the council only take action on the bond ordinance if they are comfortable with the agreement. So let me share my desktop here. So what I want to do now is give council an overview of the project. So this talks about the different agreements and the bond. And then you were provided this morning the final documents via email. So those are changed from the documents that I provided to you a couple days ago, and I'll be happy to walk through the documents. There's quite a bit of material there. So,
Ms. Thomas, are you planning on sharing your desktop? Oh, thank you.
Yeah, can you see that?
Yes, sir.
All right. Well, this is the most colorful slide. So anyway, let me just talk about the emergency radio communication project, which has been talked about in general for many years, and specifically over the last couple years about replacing the existing radio system with a different type of technology. And this would certainly be for the county, but it would be for all the participating agencies. And by that, I mean the fire districts and EMS and others who rely on emergency communications. So for the county, it would be the sheriff and public works. So a partnership is formed between Codan Communications, which provides electronic componentry and expertise. Rock Island has a network of wireless towers that the system will be attached to, and the county is kind of the steward of the project and has provided, will be providing money via the bond for the project. And the project financing is made possible, of course, by the sales tax that was passed by the voters. So the totality of the radio project is built on its several documents. So there's a resolution that binds the agreements together, and we'll go through that. There's the bond ordinance, the Codan statement of work, and then there's one of our standard contract agreements, and married to that is what we now call Exhibit A, which is the Rock Island Service Level Agreement. So anyway, all of these agreements must pass concomitantly for the project to be realized. So all these components are needed. So let me talk about the resolution. So the resolution does a number of things. So it establishes the need for the emergency communication project, identifies that we went through a state procurement process, and we waived competitive bidding. So this piggybacks the project for the Codan part, piggybacks off a Department of Environmental Services master contract whereby Codan bid to provide equipment for the state and others, which would include local government. So it establishes that both agreements are needed for the project, establishes Rock Island is the only source to implement the radio project because of their existing network of towers, establishes Codan as the chosen vendor to provide the equipment, and it also establishes that we have sufficient funding to enter into these agreements. And then finally, authorizes county manager to sign all of the necessary documents. Hey, Rick, can you still hear me?
Yep.
Okay. There's some odd, sorry, I was getting some odd connection error. So really, this is the last part of the resolution. So again, it just states that we're entering into agreement with Codan Communications of the purchase and supplies, and that we've waived bidding requirements, and then we're entered into a an agreement with Rock Island for installation, support, and long-term maintenance. So the best way to think about this, not to go back in history too much, but we had one agreement. For many reasons, we split the agreement into two parts. So Codan is where we get the equipment for the radio project and their expertise in setting up the system. Rock Island we're contracting directly with for access and use of their towers and installation of the equipment and improvements to each of the sites needed to affect the system. So on the general obligation bond, as I mentioned earlier, it's backed by the emergency communication sales tax passed by the voters, so there's 0.2% for that. 3.3 million borrowed. Estimated project cost is a little over $3 million. 5-year term. Islanders Bank has been great in working with the county in the past, and again, in this instance, to provide bank-placed financing. And if you remember, the tax goes down after 5 years once the system is paid off, and it will pay for ongoing costs. Of course, backed by the full faith and credit of the county. And then this was a question that came up a few weeks ago, but the county pays interest only on the amount drawn down. So, and then funding can happen by the end of July, depending on what council decides today. The Codan agreement is pretty long, but again, Codan is a state-approved provider of communication equipment. So we're piggybacking on this, we call a master contract to secure radio equipment. And again, it's their equipment and expertise in designing and planning the system. Codan will procure and configure and ultimately deliver all of the equipment to Rock Island for installation. And then again, there will be a partnership between Codan and Rock Island to affect the system and setup and testing and those kinds of things. Also, you'll find in the agreement are pricing and equipment schedules, and these are reflective of the state bid pricing that you find in that master agreement. One of the discussions from a couple of weeks ago was the FCC licensing process. There's new language in the Codan agreement that makes clear of the partnership and the process for seeking the necessary license or licenses from the FCC for the project. And if you'll may recall from the discussion, each of the participating agencies has their own unique frequencies which they own. There needs to be a process, and I'm sure Rick Felt can talk to this more eloquently than I, but there needs to be a process on how all those frequencies come together and function as one under one radio system. So there's better clarity on how that works in the agreement now. And then there's what we call a service level agreement with Rock Island, and attached to that is that master contract. So we're using our own form of contract because it has all of the provisions that we need to do a contract. But really the service level agreement with Rock Island, again, is to use their system. So there's two parts to the service level agreement. One is the installation activities, the prep of the site, and the installation of the equipment. And then there's the other part is the long-term monitoring. So Rock Island will be monitoring the system. So it is running, and they'll do annual inspections to make sure that it's up and running. And then they'll also respond as needed if there's any issues or errors in the system. So those are two parts that you find in the agreement. Term is 10 years, which is roughly the life of the equipment. There's a reopener for at 3 years for service costs. And then, again, it pays for all of the physical improvements to the sites. It clearly delineates what Rock Island responsibilities are and the client responsibilities. And then it has a schedule for pricing, costing detail, and a kind of a draft project schedule that gives you a sense for how long it'll take to get the system up and running.
And Rock Island provides all the maintenance, right?
Yeah. So there's a monthly fee assessed for maintenance and monitoring of the system. So that's a very high-level overview. I can pull up, if you'd like, each of the documents and walk you through those at this time.
Not necessary for me.
Okay, Mr. Stevens?
It's not necessary for me.
So there's one outstanding issue, or not really an issue, but an activity. And so there's another agreement that has to do, it's really kind of in Tony's part of the world. So we pay Rock Island for connection already each month to their system for communications. So added to that, to our bill for that will be another charge for connection to the Rock Island network. So this whole thing runs on the fiber network and is IP based. So we'll be charged another connection fee for that. And there was a draft agreement. I think it's another $500 a month. And also in that agreement will be some simple language regarding, we'll use the term lease, but we want to affirm that we have access. We do have access and right to the pole under the service level agreement, but we'll perfect that language in a subsequent agreement. So the subsequent agreement will touch on the lease and then the connectivity fee. So I'm frankly not really worried about those because I know those will happen when Tony comes back. These other agreements are more important. So, but I did want to give council a heads up that there'll be one more agreement coming forth. But I think we have what we need to get this thing finally up and running. So anyway, I'm happy to answer questions. I know Rick Felt is on the line, and Alan from Rock Island is online, and they can answer questions. And I can bring up each of the agreements if you want me to walk through them.
Council, Mr. Watson?
Nope. So I've gone through the agreements, and it looks like we have all the pieces now that we were missing before. So I think we're in good shape.
Mr. Stevens?
Well, I looked through the first ones and then I looked through these, and the only thing I would is John Kane on the line, or is he out? Or
I think I see John.
Yes, I'm here, Councilmember Stevens. This is John Kane.
I was just wondering, is this you had some issues with documents before? Do these fit okay now?
They do. So I have to say that the county manager and Rock Island and Codan have put in a lot of time and a lot of work on the agreements since we talked about this a couple of weeks ago. And yes, the main issues have been resolved. The primary concern that I expressed a few weeks ago was that since we're purchasing Codan services through a state contract, I wanted to be sure that we were only purchasing the services that Codan is authorized to supply through the state contract. And that has been resolved. That's some of the work that was included in the Codan contract, we now understand was meant to be done
was open, right?
through Rock Island.
Okay, thank you.
And now that's been cut out, and the county has a separate agreement with Rock Island. I can't say that I'm knowledgeable about how radio systems are designed or installed. I note that there is quite a bit of time. I think it's something over 3,600 hours of time of labor that Codan will be spending on designing the project. It's a big number. Again, I can't say the first thing about how much time it takes to design a radio project, but I can say that it fits within the boundaries of the state contract just fine. The Rock Island agreement, as Mike Thomas mentioned, there are some components that haven't been finalized yet, and those are the network connection fee and the specific leases for the sites. So I think it's important for the council just to be aware that those future steps will come. In terms of the lease, on the one hand, I'm uncomfortable recommending that you move forward, or recommending that the project is ready to move forward now without having the leases in place. On the other hand, the final system design still needs to occur, and so the sites could change, and you can't have a lease for maybe sites. You have the lease for the specific sites, and the agreement with Rock Island makes clear that the leases will be made and that there's no additional fee for the leases because they're essentially an extension of this agreement. So those are sort of the highlights of what has happened in the last few weeks, is separating the installation and lease and ongoing maintenance into a Rock Island contract and leaving the system design and basically all of the radio components with Codan. And so I do find that these agreements and the resolution as they are now are satisfactory as to form, and I'm happy to answer any other questions about that.
Thank you.
Answer your questions. You're fine. Okay. Mr. Watson?
I have no questions, and I would point out that, there is a milestone in the project plan at the completion of the final design, and, worst case scenario, we can always bail at that point if it doesn't meet our needs.
Mr. Watson, you have an echo going. Is it possible for you to turn off something in your office?
It's not me. I'm not echoing.
All right. For process sake, if both of you are okay with the items that Mr. Kane just announced, I'd like to go back to the public hearing while they're tied directly. The public hearing is not about the other subjects, it's about the bond offer. Are you okay if we just circle back to that since we are in a public hearing?
Yep.
And
yes.
You're both okay making a decision on the public hearing information?
Yep.
All right.
Yes.
Thank you, Mr. Thomas, and from Codan and Rock Island, et cetera. Thank you for all the work. Right now, we're in a public hearing to adopt an obligation bond ordinance. At this point, I'll open up the public hearing for anyone who has a comment regarding the public comment section of the public hearing regarding this subject. Is there anyone who'd like to provide public comment in this public hearing? If you're on mute, please unmute and speak. Again, I will ask one final time. Is there anyone who would like to provide public comment regarding this public hearing to adopt an obligation bond ordinance? Without seeing anything, I will close the public comment section of this public hearing with the right to reopen. Any additional comments regarding the bond from Mr. Watson or Mr. Stevens?
Nope. I think it's I think it's important we get this done, and so everything can be done by the end of the month, as the treasurer informed us last time, or 2 weeks ago.
Yep.
Agreed. Mr. Watson, you're all right?
Yep. I'm good.
Outside of thank you to all the people involved and to the public for supporting this, I have no further questions. I'd entertain a motion for approval.
Mr. Chair, I move we approve an ordinance of the County Council of San Juan County, Washington, providing for the issuance and sale of a limited tax general obligation bond of the county in the principal amount of not to exceed $3.3 million for the purpose of financing emergency communication systems and facilities projects, providing the date, form, and repayment terms are of said bond, and providing for the annual levy of taxes to pay the principal of and interest on the bond, and approving the sale of such bond.
Second.
We have a motion and a second for an ordinance of the County Council of San Juan County, Washington, providing for the issuance of and sale of a limited tax general obligation bond of the county in the principal amount of not to exceed $3,300,000 for the purpose of financing emergency communication systems and facility projects, providing the date, form, and repayment terms of said bond, and providing for the annual levy of taxes to pay the principal of and interest on the bond, and approving the sale of such bond. Are there any further questions?
Nope.
Nope.
Without seeing any, all those in favor say aye.
Aye.
Opposed? Motion carries 3-0, and that will bring our public hearing to a close. To continue on the action item that we were just discussing, which was tied to the public hearing, approval of a resolution authorizing a statement of work with Codan Communications and service level agreements with Rock Island Communications. Mr. Thomas, is there anything further you'd like to go over regarding the documents you just previously addressed?
No, I think my summary provided with John's comments. I think that's it from staff, unless council has any further questions.
No, just actually going back to public hearing for a second, just wanted for the record to point out that the rate for the bond is 2.38%, which is a really good rate. Thank you for the work on that. Mr. Watson, do you have anything else regarding the Rock Island and Codan agreement?
Nope, I think they've done a great job with their latest revisions and work that they put into it. And, it is a complicated package. So, it took extra effort to get all the pieces in place, and I appreciate the work that everybody did.
Mr. Stevens?
I don't have anything further.
All right, and neither do I. Thank you. To echo Mr. Watson, thank you all for the work that was put into this program. I'm looking forward to having a safer environment for our first responders. I'd entertain a motion for approval at this point for the resolution.
Mr. Chair, I move we approve a resolution authorizing the county to enter into contractual agreements necessary to support and implement the Emergency Communications Radio System project and waive certain public bidding requirements.
Second.
We have a motion and a second for a resolution authorizing the county to enter into a contractual agreements necessary to support and implement the Emergency Communication Radio System project and waive certain public bidding requirements. Mr. Watson, Mr. Stevens, is it all right if I add and have the county manager or authorize the county manager to sign on our behalf?
It's in the resolution.
It's in the resolution.
All right, thank you. Just wanted to clarify. Are there any further questions? Without seeing any, all those in favor say aye.
Aye.
Opposed? Motion carries 3-0. Mr. Thomas, that one resolution will cover everything we need to do, correct? Or is there another approval?
No, you've approved both of the agreements, Codan and Rock Island, and then you approved the bond ordinance. So that's the totality of the radio project. I'd like to thank John Kane for what ended up being quite a few hours on this agreement. He looks forward not to spending time with me the rest of this week. And I'd like to thank Alan from Rock Island and his folks, and Rick Felt from Codan and his staff for really buckling down and getting this thing to the finish line. And also thank Dave Halloran and Tony for all their work on this agreement, but then the work yet to come to make this thing a reality. So a lot of really good work. So it is a pretty momentous occasion for the county to step forward into new communications for our first responders. So thanks for everyone's help on this project, and PFM.
So, Mr. Thomas, remind me, are we going to need agreements with the other first responder agencies?
At some point down the road, we may need agreements with them, but not at this point.
Right. Okay.
Great. Thank you.
All right, Mr. Thomas, thank you for all of your work. I know you spent ample time with you and Mr. Kane and the various parties you mentioned, so thank you very much for moving this forward. Our next discussion item is COVID-19, or it's our weekly update, our COVID-19 coronavirus emergency response update. Mr. Dodd, are you ready to chat?
I am. Good morning. We're actually going to mix it up on you this week, Chair, and Mark's going to go first. Just when we had you in a groove.
Exactly.
You're going to start off with those awesome graphs. I appreciate it.
Yes.
All right, Mr. Mark.
And I thought I shared my screen.
We got it.
Oh, you got it? Okay. So we thought we would start again with the information from a statewide perspective, and then get into our local response and some of the other questions that the county had, council had regarding staffing. So I pulled up the Washington State risk assessment page, and you can see that here at the value rate per 100,000 newly diagnosed cases continues to increase. So I think last week it was about 120, it's 126.5, and this gives you a picture of the 5 key metrics that the state is monitoring. The only metrics that we're meeting as a statewide system is around our healthcare system readiness, where we continue to have the percent of licensed beds occupied underneath the goal of 80%. Statewide it's at 56.5, and then the percent of licensed beds occupied by COVID cases at 3.7, with a goal of 10%. What I would like to show, and I'll just click through these, is this shows graphically that percentage, and you can see that the hospital bed percentages remain in that 60 to 55 to 60% range, and have from really the beginning. And so, or this goes back into May, and you can see that the capacity with the number of beds remains in a good spot as a system. If you look at the trend on COVID cases, we're currently at 3.7. You go back into the beginning of June, which was the last time we were at 3.6 on June 3rd. It was down around 2.6, and since that time in the early parts of June, it's been slowly increasing up to the 3.7. Testing capacity. This is, again, the goal is to have a significant amount of testing with at least 50 tests for every new case in the state. We're significantly under this as a system, and have been from the very beginning. It is improving from back in March, early on, where we were at 6-7 tests per case. Now we're up at about 18, but nowhere where the state wants to be. The percent positive. Go ahead.
Sorry, I just wanted to point out that at least on the graphic on the left with the different counties, I assume blue is good, and that San Juan County is one of 4 counties that is testing above 50. That's good, correct?
Correct. Yes, and thanks for pointing that out. So the map over here, as Councilmember Hughes points out, indicates which counties are above 50 tests per each new positive case, and then the ones in orange are the ones that are trending below. So blue, yes, would mean that you are above the 50 tests per case, and so San Juan County is above that. This shows the number that percent of individuals testing positive. And again, the goal is less than 2. We're at about 5.6. and again 5. And so these gray bars out here are not complete yet because this is based on when the case indicates they're symptomatic, and so they'll be continuing to update these numbers as positive test comes in. Again, as Councilman Rick points out, we're at 1.6 right now in the past week here in San Juan County. Disease activity. This is what I think a lot of people are concerned about in our state. So you can see where we were at between March 21st, 22nd, and April 4th. This is a 2-week average. We were at 72.2. That is now at 126.5. And so it kind of gives you a sense of what is happening statewide. And going back to this map, the darker colors is a rate that is higher per 100,000. The lighter the shade of gray down to blue is information that is better, and we'll get into some specific items as well. This is new hospitalizations per 100,000 people. You see back here in April, we were at 7.2 per 100,000. It's currently at 3.4. And so, but it is trending up from the middle of May, where it was down to 1.7. It's now up to 3.4, and the line is trending up over that last 2 months. Something to be concerned about. The reproductive rate. And this is broken out into, I'm just going to show you Eastern and Western Washington. So Eastern Washington, it's at, and less than 1 is good. That's what you're looking for. The goal is having it less than 1 and going down to 0 to really eliminate the disease. Where we're currently at in Eastern Washington, it's at 1.3, and you can see it, upper confidence is either 1.5, lower is 1.5. Well, actually, it's estimated as 1.4. Lower confidence is 1.3. Upper is at 1.5. If you look at Western Washington, it's they estimate at 1.5, with the lower at 1.3 and the upper at 1.7. You could see back in April, we actually had it below 1, and we had it below 1 for a significant portion of time, and now it has been trending back up and is at the 1.5. This means that for every case, it's anticipated that another 1.5 individuals gets disease, which then means you are effectively spreading the illness across the state. You want it less than 1. So for every case, less than 1 individual is contracting it from that individual case. And so again, something that we're looking. Healthcare readiness system and show you our region. I'm not going to go through and show you the Western and Eastern Washington. That is something that I think we have more time we would do, but this will just kind of show you our region and what we look at as far as in our area. So this looks at the 5 counties, so Island, Skagit, Snohomish, Whatcom, and San Juan. Right now we're at about 71% of our beds occupied in our region, and kind of indicates that we've been holding steady, maybe trending down a little bit in the last week or two. And then here are the percent of licensed beds occupied by COVID patients, and we're all in the blue on that. Again, currently at 2.2. And give you perspective, back at the beginning of June, we were at 3.5, 2.9. So that is actually looking good. But as we know, hospitalizations actually lag a little bit behind number of cases. If you look at testing capacity in our 5-county region, we actually had it above 50 back at the end of May, beginning of June, partly because there was less positive cases. And so as the number of cases increased, it went back down, and we're currently at 22.8, and it is trending back up. If you look at the disease activity for our region, we are less than it was at the peak back in the end of March, beginning of April, where it was at over 100 cases per 100,000. Right now, we're looking at the 67, 68 cases per 100,000, and it's kind of been there and looks like it's going to stay there for at least about the next few days. And if you look at new hospitalizations, it's up and down. You could look at maybe it's trending up in the last 2 or 3 weeks. Is something we need to keep our eye on, but something we would definitely want to look at. And we're looking at about 2.4 right now in our region. These are the rate of 2.4 hospitalizations per 100,000 in those 5 counties. Again, if we had more time, I would show you both Eastern and Western Washington and the what's going on statewide. I would encourage you to do that. I want to kind of switch screens a little bit and go to this is from the situation report. And if you were looking at, this is looking at the 2 reproductive rates. The red line is Eastern Washington, and you can see in Eastern Washington, it's actually never really been below 1. It got close to 1. The shaded areas are the error bars, and it continues to trend up. The purple line is Western Washington. Again, we had it below 1 for a significant portion of time, and it has now trended back above, and looks like it maybe has plateaued and is hovering about 1.5. And so we need to, again, work to get that down as a system below 1. This is looking at the growth rate of newly cases and hospitalizations. And so looking at both Western and Eastern Washington. So these are the new cases over here for Western Washington. You saw this peak, went down significantly, and is sharply rising back up. The positivity rate went down, but has been creeping back up as the number of cases has increased. So we are doing more testing, but so it keeps the positivity rate down a little bit lower. However, it is trending back up. Hospitalizations starting to creep back up in Western Washington, and it's something we need to monitor and take a really close look at. Same thing with deaths, and as we know, the hospitalizations and deaths lag a little bit on new cases, and so they're a little bit behind, and so something we'll have to monitor. Eastern Washington, it's a little bit different. You'll see the cases continue to climb. There was not this bell curve. They've never really had a peak, and they're still climbing to their peak. They've been increasing the entire time. The test positivity rate is actually flattening out. Hospitalizations continue to increase, and deaths were up and then down. But if you actually probably draw a line on there, they really not doing the statistics on it, but it's probably slightly increasing over time in Eastern Washington, and certainly in the last month, it's increasing over in Eastern Washington. If you look at the age range on where these tests were positive and where the cases were, this is a graphic display showing Washington, then I'll show you Florida, and we know what's happening in Florida. Early on, it was the cases per 100,000 were really in the older population, and the younger populations were really not seeing a lot of it. Now we're seeing it in this younger population, and so the shades here clearly show that our younger population is where the disease is occurring currently. And what it looked like in Florida is it started out in the younger population, and then as the weeks went on, it started getting into the other populations, and that's the concern here in Washington State. As the younger populations get it, and either visit family or live with family or go to work, it can spread into these other populations, and the concern is that we're seeing similar items to what Florida saw early on. So if you go back here to Florida, you can see it started out here, and then it spread to the next cohorts, the 30s up to the 50s, which it looks like it's starting to do here, and then it started getting into the older populations as well. And so that is, I think, the concern that the state has, as do other states have experienced the same kind of phenomena where it starts with the younger populations and then moves into the older populations, either through these young adults living at home, passing it on to their parents, or going to work or to coworkers, and then that's how it spreads. So kind of give you a snapshot of the situation report from the state. The other document that I want to show you at this point is this is from the University of Washington and their IDM, Institute for Disease Modeling, and it kind of gives you an idea of what they project going out, and it talks about whether you ease restrictions or you have mask use, universal masking, and what it does with the number of deaths. This is that first graph, and you'll notice that if you ease restrictions, the death rate goes up. If you have universal masking, the death rate remains, while it may increase over time, significantly less than it would be if you ease those restrictions. And this is on total deaths. This is looking at it from a daily perspective, where you can see it even a more pronounced increase in the daily deaths. And so it really shows the importance of masking and maintaining some of the social distancing and whatnot. This is looking at infection rates. Again, if you're easing restrictions and not having masking, what happens to the infections versus if you have those in place, and then on the hospital as well. And so this kind of gives you that snapshot picture. This bottom one is tracking the social distancing, and this is based on mobility and what's been observed. You'll see that over time, when we had the stay home, stay healthy proclamations, it was reduced by about 50% from normal, from the typical mobility. We're now up into the about 20% decrease in mobility. So definitely seeing an increase in folks out moving around. Part of that is as we ease restrictions and open up certain things, people are moving, and it's something that we've all seen here, where more people are coming as we have eased those restrictions as a state. So with that, I'm going to stop and see if there's any questions in regards to the information from a statewide or local perspective or regional perspective before we get into some local information from Kyle.
Mr. Watson?
No questions at this time.
Mr. Stevens?
No questions.
I don't have any either, Mark. Please continue.
Okay, I'm going to turn it over to Kyle and have Kyle give an update on the local situation.
Thanks, Mark. Good morning, Council. Kyle Dodd. So just start off with some perspective. So it's been 6 months since the first case was diagnosed in Washington State, and I certainly didn't foresee the impact that first case and obviously the subsequent outbreak that we're currently living has had on just about every aspect of our daily lives. So just again, some perspective as time goes by. I know in some days it feels like it was yesterday, and other days it feels like it's been years since we've kind of been moving through this outbreak response. Locally here, we're still holding at 24 cases, and thankfully it was a quieter weekend for our case investigation contact tracing team. We have completed 2,364 tests as of the update last Thursday. give you an update on our Phase 3 application. So there's quite a bit of discussion last week regarding the status of that. So after the governor paused all movement between phases on July 2nd and then extended that to the 16th, that was extended again till the end of the month, 7/28. And we learned yesterday that the Secretary of Health returned all 7 county applications that were on hold. Ours was one of them, so we have our Phase 3 application returned to us. We will remain in Phase 2 for the foreseeable future. The statewide situation has changed quite a bit, and information in the applications is now at least 4 weeks old, and even if they do allow new applications on 7/28, the data would be even more stale. So based on those changes in the situation, the application process may be modified as well. So there's no indication or timeline on when they will accept applications to move between phases again. But we know that, again, our application for Phase 3 was returned, and we are remaining in Phase 2 for the foreseeable future. A couple of projects that were instituted this last week. So we've received 50 no-contact infrared thermometers from FEMA with pretty specific guidelines on how those can be distributed. And Brendan has put together a quick distribution plan and is working with the Chambers of Commerce. They're dedicated for small businesses less than 50 people that have a high degree of in-person interaction. So working through the chambers, we've identified several small businesses that fit this criteria and are working on deploying those for the purposes mainly of employee health screening. As employees show up, that infrared thermometer can be used as a screening tool. So that is ongoing.
Hey, Kyle. Sorry to interrupt you. This is Brendan. I just want to clarify quickly to avoid confusion. The limit on distribution of those is businesses of 10 employees or less. So that's all. Thanks.
Perfect. Thank you, Brendan. The other project that's ongoing is the face covering survey, which was rolled out. And this is a project to really gather data on the compliance of face coverings in the county. And it'll be three-pronged. So one is monitoring selected arriving ferries at 3 islands. 2 is surveying local businesses. And the third part is just to take some time to assess people that are out and about walking around. So many partners have volunteered to be a part of this, including council members, Board of Health members, our Chambers of Commerce, the EDC, and county staff, as well as other volunteers that have been working with us on the emergency response. So the idea is we're gathering data, and we're going to assess that data and determine the potential outreach opportunities and needs from there. And then the idea is we can compare the trends and effectiveness of that outreach by duplicating this survey again in the future. So thank you again, Brendan, for your leadership on both that face covering and the thermometer distribution project. Really appreciate it. The last thing that I want to touch on is our current testing efforts. So we have been completing ongoing testing as part of our emergency response, and we have done that every Tuesday for the last 5 weeks, and we are booked out through August every Tuesday, rotating between San Juan, Orcas, and Lopez. Our team was on Orcas last week, and I happened to be there helping out and witnessing that. And they're on Lopez today. And in addition to targeting initially businesses with essential workers greater than 25 employees, we're also working in a directive from State Department of Health to test residents of long-term care facilities. So those individuals are also being tested as part of that. And we have been flexible, again, knowing what our capacity is, working through this several times and getting specific requests to round out our testing day. We have been working in other businesses less than 25 employees that are willing to, again, partner with us and pay the $125 lab fees for that testing of their employees. The other part of testing, we're working to expand the ability to test, and a company called ADX, who's a subsidiary of Northwest Labs, the local lab in Bellingham that is kind of on the forefront on turnaround times, usually getting results back between 24 and 48 hours after the lab receives the result. We're working with them to provide some additional capacity in our county in the form of a mobile testing van, and in conversations with them right now. But again, this would be a partnership where we would help advertise, get the word out to the public that then could sign up. We would also help set up and take down. Again, doing whatever we can to increase testing capacity out here. And the idea that would not just be for asymptomatic essential workers like our current testing program is geared toward, and that would be expanded to allow them to test both essential workers and then others in the community that would want to be tested as kind of a morning and afternoon to round out the day. And so hope to hear more from them tomorrow with our ongoing conversations, but we did talk yesterday, and August 5th would be the soonest start date that they would be able to come out and support. So wanted to give you an update on kind of where we've been with testing and the direction that we're going. So with that, I'll stop there. I can answer any questions, and then I can turn it back over to Mark to talk about our continuity of operations plan and our staffing.
Mr. Watson, do you have any questions?
Yeah, so I think I saw an email this week on the subject of asymptomatic testing of San Juan County organizational departments. What's the status of that, and should we not be planning on testing at least, all county employees that are interacting with the public?
Bill, could you clarify what is an San Juan County organizational, whatever you said?
Well,
county staff.
County staff.
Sorry. Hey, Kyle, do you want me to cover that?
Go ahead.
So thanks, Bill, for the question. Yes, we have drafted a guidelines for county staff. We are a business with 25 or more employees that have people who are public facing. We sent that plan out, those guidelines out yesterday, and have encouraged folks the departments who have signed up. I think there's about 4 different departments have expressed interest. They are sharing the eligible staff, and those are staff who have regular contact with, as part of their jobs with the public, as determined by the department head or elected official. The department head or elected official will send the names of those staff members who meet those criteria to our testing coordinator, Abby Anderson, who will then work with those staff members to schedule a time slot for them. We'll work them in to our regular asymptomatic testing program, so they will be given a opportunity to fill out a registration link and then go to the testing site where they will be tested as part of our testing program. And so that will be back on San Juan Island next Tuesday. And I believe a couple departments have submitted a list of names to Abby Anderson for that event, which would be next Tuesday.
So my understanding is this is optional. It's specific department heads can request specific personnel, and San Juan County is picking up the cost of these tests?
Correct. And it's the employees can opt out if they don't want to. So it's up to the department head or elected official are the ones that determine if the staff member meets the eligibility requirements. That is, they have regular routine contact with the general public. And then the employee can opt in or opt out. The employees can say, I want to participate or I don't want to participate. It's voluntary on that perspective. And then, yes, the county would pay for the lab costs, $125, just like any other business would.
And I don't understand the employees can opt out.
It's voluntary. It's not required. So we did not mandate it for the staff. The staff do not have to participate. That was how the guidelines were set up.
So what does council think of this?
Mr. Stevens?
Yeah, I don't know. Since it's all kind of new, I haven't had a chance to think about it that much.
My position is I would hope that employees that are in contact with the public would be tested on a regular basis, and it would just be a policy.
Well, and that's certainly where I'm leaning, which is if we've got public-facing employees, I think we have an obligation to not only keep those employees safe, but the rest of the department's employees safe. And the only way to do that is reliable and consistent testing over a period of time. And I would ask Dr. James, I mean, you know, just because you're tested once doesn't mean you don't catch it, you know, or get exposed to it the very next day. So what kind of frequency of testing should occur to try to, I mean, there is no guarantee, right? But to at least monitor the situation adequately.
Yeah, so Bill, you're absolutely correct. We are doing it. It would be every 3 weeks. We'd be back on San Juan Island. It comes down to resources and staffing, and so this is a snapshot in time. And this is looking for, as we know, we did one testing event where we had a positive through an asymptomatic testing event, and it's really looking for those individuals who are not showing symptoms that may be have the disease. And so there is, again, this is a very much a rough snapshot in time, and I'd be happy to work back with James and Mike if you want to change it into a policy and require it for staff. But I think that's a different conversation. And again, I'm not aware of any staff opting out. It's just that this would be up to the individual staff members whether they want to be tested or not.
And what are other large businesses doing relative to frequency of testing for their frontline workers?
It's all over the board. Some are testing upon when they come to work, and some are doing follow-up testing. There is no consistent, that I'm aware of, any consistent testing regime for any business here in the islands.
So I noticed Dr. James is supposedly on the call. Do you have any comments, Dr. James?
Sure, I'm here, Bill, and I've been listening. There is a big interest in testing. I think the limiting factor is not going to be people's willingness to test. It's going to be our ability to pay for the tests. We were able to work. I was able to work with Northwest Lab to get the price down some, and there's an possibility we can get the price down even more. But at $100 a test at the very minimum, and 120 or 25, that's a significant cost. So I think my experience with people is that the vast majority of people want to be tested. I don't think there's going to be a problem with people not wanting to get tested at this point. We may see some fatigue with that over time and try to figure out how to move forward as a requirement or as an incentive basis. But I think for now, I think the main thing is just having enough swabs and staff to get the testing done is a bigger worry to me than people not getting tested that need it. So I think at a practical level, that's the barrier I'm working to take down. And access to adequate testing. We've been fortunate, extremely fortunate to have access to high quality services. Recently, we needed a stat test. I was able to deliver to the lab. They were able to run it overnight, and we got an answer within about 8 hours. So that's extraordinary, given that other commercial labs are 6 to 8 days out, which in terms of contact tracing is useless. At that point. It becomes extremely limited value when you have that kind of delay. So I think this is a extremely good initiative. It is the responsible thing of the county to do. It's very timely. I think Mark's brought forward, a practical approach. I personally don't think it would delay things considerably to make it a requirement, and I honestly don't think a requirement is necessary. I think people are going to want to be tested. People want to know. The vast majority of tests, of course, are going to be negative. That's what we found. We've done a lot of testing now, and that's the good news. There's very little disease on the island. Most of all of our cases are traceable to somebody that comes from off the island. So I think but it is a responsible thing. We only need one case that is a particularly contagious case to spread the disease. Again, 2% of the population is responsible for 20% of the infections. We got to find that person that's going to be one of those 2%. We haven't had really outbreaks in the sense that other people have, and that is going to be in our future at some point. We need to, and that's what this screening does. It finds those people early, and we have through screening, even on our island, found those people that weren't symptomatic. Again, 30 or 40% of people have no symptoms. The vast majority of people that spread this disease spread it before they develop symptoms. So those are the things that mandate testing. And it's really just working as fast as we can to get as much testing as possible. And I've got to say, the hospital has done a great job. It's got a new system in place that allows for testing between 10 and 12 every day, Monday through Friday, pardon me. And also a process for including people that aren't registered patients there. Dr. House at Eventide has done an extraordinary job, vast amount of testing, one of our best partners. And the university clinics have done a solid job on their part as well. And Dr. Schinstrom's practice is even getting in, they're fielding a team doing it. So I think, and then of course the efforts of Ellen to develop our own testing team here and our new staffing that's there are yielding results. Those are all a very assertive approach that we've had. I think we're in good shape for a place that doesn't have a lab locally. I think we've had remarkably good effort and good outcomes so far. But we obviously need to employ these new strategies to expand and maintain what we have. I just say one last thing is that most of the cases that we're seeing in San Juan are not outbreak related right now. Almost all of them, if not in fact all of them, are people coming to either take a job or to, for the most part, visit a relative. So relatives, friends, and neighbors in your home, that's where the risk is. You want to be careful. Be careful in your own home, and it's the friend, the neighbor, or the relative. Those are where the cases are and the ones that we've had in San Juan County so far. Now we've got to prepare for outbreaks, and they certainly can happen. And that's what this asymptomatic testing is about, finding those people. That's what this screening effort, which is actually new to me, the mass screening. I didn't know that that was taking place, but that's a wise thing to do. I think we should look not just at the people walking off the ferry, but the people on the ferry. I found a huge discrepancy in that. I saw 2 people walking off the ferry without masks on. I saw 68 on the ferry without masks on. Pretty different. And those people are going to take their habits and beliefs with them. So that's my take, Bill.
Thank you, Dr. James. So then follow up, Mark, how many roughly can you estimate the number of county employees currently requesting or that has been requested to be tested?
So I don't have exact number, Bill, because Abby Anderson is who they're sending their information to. I think I've seen about 8 county staff identified from the elected / department head that have been forwarded on for testing for next week, 8 or 9. I would anticipate it's going to go up. I just sent out the information last night to the elected department heads.
So how much funding request are you making?
We've already made the request. It was for CARES funding, and it was, I believe, for $80,000 in CARES funding for testing.
Okay.
And we already approved it, I think, last week for the allocation. Mr. Watson, are you finished with your questions?
Yep, thanks.
Hey,
Mr. Hughes?
Yes, sir, Mr. Thomas.
Well, I'm sorry, I didn't mean to interrupt your question. To maybe when Jamie's done, circle back to me. I have a question for Mark.
Ms. Stevens, do you have anything?
I just, I believe it's a good idea, and I don't know if we have to make it mandatory because, as Mark brought this up already, Randy had weighed in that he'd like his attorneys tested. I think it's as long as we agree with Dr. James, as long as we can get meaningful results in a timely manner so that they're meaningful, I think it's a great program.
Great, thank you. And hold on a second, Mr. Thomas. Mark, if you could answer me a quick question. I went on the site and it says we've done 2,364 tests to date. Is it fair to say roughly we've tested about 13% of the county population?
I'm assuming you did your math correct, yes.
All right. I just think it's important to know that we are slowly reaching out to our community and getting a broader scope of people tested. Thank you. Mr. Thomas.
Yeah, Mark, have you looked at what other is evolving? So there's not really a standard yet, but have you looked at whether any jurisdictions are doing good things other than testing, like temperature check before they enter the building?
It's an excellent question, Mike. I have not. And so we can certainly reach out to see what others are doing. We are looking at, and I'm beta testing a health screening upon logging in that would be a self attestation that you don't have symptoms. And so that'd be something we'd be rolling out where you're as a staff doing your own screening and saying that you do not have any of those symptoms or haven't been around anybody you haven't knowingly been around somebody with who's been diagnosed with COVID. And again, that's in a beta test right now.
So I saw that come out this morning. Is that intended to go to all staff?
It would be, yes. And again, it's in the beta testing format and working with James and Tony to do it upon login so that as somebody logs in, it identifies what building they're in, how long if they tend to work there all day, and then they attest whether they have those symptoms or not or been around somebody. I guess another tool to really try to identify folks and hopefully no one's coming in with any symptoms. They're not supposed to be. We're encouraging people to take sick leave. We have a great sick leave policy and no one should be coming in with a fever, or sick. And so they should be staying home. This is just another tool to have people think about that and self-attest to it before really staying at work for any length of time.
Okay, thank you.
Great. Are there any other questions for staff regarding our current COVID-19 situation?
I don't have any.
Me neither.
All right, great, thank you. Obviously, our next discussion action item, I don't think we need to have since the state has returned our phase 3 application, so I will mark that from the agenda unless anyone feels like we need to actually address that question at this point.
I don't.
Nope, me neither.
Great, so it's 10:25, but let's take a 15-minute break and come back at 10:45. Thank you very much.
Okay.